Welcome to Pharmacy Technician Classifications. This is an important segment of our 6-week program. Please make sure to take down very neat notes because you will refer to these notes when you're studying on your own time. In this segment, you will learn how to categorize your medications by the conditions they treat. Please use this opportunity to get your notebook because you will have to write down all medications. Please turn your notebook sideways because you will be writing your medications down in the form of a chart in your notebook. Your chart will consist of 5 columns, so you will need to make vertical lines to separate each column. This is how your column should look in your notebook, which is already turned sideways. Between each subject, you should draw vertical lines to separate the columns. The first set of medications will be asthma. Please write the word asthma under the condition treated slot. In the very next column named generic name, please write prefix, root, suffix. Asthma. In your brand name column, you will be listing medications by their known brand name or trade name. In the generic drug name column, you will be listing medications by the scientific name. Here's an example of name brand and generic brand medications. Tylenol, as we know it, is a pain reliever that we see in store on the shelf, but Tylenol can also be labeled as acetaminophen. This is the generic or scientific name for Tylenol. Now let's get ready for drug classifications. Asthma. This is how your asthma chart should appear in your notebook. You may want to pause this video and take a few minutes to jot down all the information. Check out brand name columns. Brand name columns consist of popular medications that treat asthma. Let's take a look at Singulair. Singulair has under the generic name column suffix Lucas. Drug classification column, leukotriene inhibitor. Generic drug name column, Montelukast. Notice the contrast between Lucas and Montelukast. They have the same ending. These are indicators to let you know which generic drug goes with this class. Still on asthma. Now that's exactly how your chart for asthma should look in your notebook. Now let's look over what we just wrote down. In our generic name column, you have the prefix, roots, and suffix for generic name drugs. These are indicators. When you see these prefix or suffix at the beginning or ending of a medication, you should know which condition to associate it with. Here's an example. If you see medication Montelukast, you should be able to look at the suffix and tell that this drug treats asthma. Also, medications ending in terol should let you know that it is an asthma medication. The medications that have NA in that column does not have indicators in their names. So for some of these medications, you will have to revert to memory. In other words, learning these drugs by using the suffix as indicators should make it easier for you to know which generic drug belongs to asthma, high blood pressure, or even high cholesterol families, and etc. So if you see a generic medication name albuterol, you should know by looking at the indicator terol in the word that this medication treats asthma. Ladies and gentlemen, this is the trick to learning your medications easy and efficiently. Keep in mind that even though you can use the indicators to tell what the medication treats, you usually cannot tell what the name of the name brand medication is to the generic brand by using the indicators. You must revert to memory to know which name brand drug goes with its generic drug. On your asthma chart, you might have noticed a star next to some of the medications. These stars are to let you know that they are popular drugs and have a high chance of being on your exam. Here are some extra nuggets you need to know about asthma. You should write this information down under or close by your asthma chart so you know which conditions they apply to when you are studying. One thing you want to add in your notes is bronchodilators. Bronchodilators mean to open up the airways and or the bronchioles, hence the suffix dilator. Here are more additional notes on asthma. You cannot mix any kind of beta blocker with a bronchodilator, so no one patient should be prescribed both. All leukotriene inhibitors are in a tablet form and not in a pump form, so that lets you know that not all asthma medications are in the form of a pump. COPD. COPD is an acronym for chronic obstructive pulmonary disease. COPD is a respiratory disorder that can be any one of these: emphysema, chronic bronchitis, or asthma. Asthma is the only COPD that is reversible, meaning emphysema and chronic bronchitis are more permanent disorders. However, asthma with proper treatment can be done away with. An individual can stop having asthma if properly treated. We know that right now all of these notes may not make much sense to you at the moment, but as the process of learning all the information we have for you continues, you will understand it as each chapter is reviewed. You can also find medications in your textbook on page 115. Please feel free to contact us for any questions or concerns using your inbox in your student profile. And remember to have a good day.